So thank you for having me talk today. I'm going to talk to you about some of the work that I'm doing in my lab to improve the management of pain in young people with a focus on young people with sickle cell disease. So just some disclosures. One of the projects that I'm going to talk today about, Peer Project, was funded by an unrestricted grant by Pfizer. And then the I Can Cope app, which I'm going to talk about, was funded by NIH. So as Haley said, I run the iOUCH lab, which is really focused on improving outcomes in young people with chronic pain using digital therapeutics. So my lab really focuses on developing, evaluating, and then sustaining digital therapeutics. And we do this using this vision that I have up here, where at the core of everything that we do is principles of equity, inclusion, and diversity. So before we start something, and just because most people love technology, young people love technology, doesn't mean that it's the right solution for everyone. So we always start with authentic partnerships with young people to make sure that this is really what the solutions are that they want. We then develop them in co-design with young people. Yeah, I might use that so I can see my slides. Thank you. Is this on? Yep. Okay, perfect. We develop them and then we want to implement them because we know that most research takes at least 14 to 15 years to get translated back into practice. And the goal in our lab is to develop technologies that can be used into practice immediately after we've evaluated them. So we also do a lot of implementation science, and I'll give you an example of that. So I'm not going to talk about pharmacology, but we may talk about that in the next session. Because really in young people, there's not great evidence that we have good drugs to help with chronic pain. So the practical implication of this is that we need to focus more on psychological and physical management strategies for chronic pain. And I like this image because young people with sickle cell often tell me they feel like their pain is invisible, people don't believe them, and they hate the numerical rating scale because they always say, my pain's worse than 10 out of 10. And then no one believes them, or very few people believe them. So one of the first things we did was we did a qualitative study exploring the information needs of young people before they were going to transition to adult care, and then immediately when they had transitioned. So this was a partnership between SickKids and UHN, where we interviewed young people either in individual or focus group interviews who had sickle cell, some of their caregivers, and we also interviewed healthcare providers. And the key theme across all of those groups were they talked a lot about the impact of sickle cell disease, their experiences with trying to self-manage their conditions and the challenges that they face with that. They provided a lot of recommendations on what we could do to help them improve self-management and to help them transition better into adult care. And we heard that yesterday, that we really want to ensure young people transition successfully to reduce the comorbidities that happen if they don't transition successfully. And then they told us about what they would like in their ideal digital self-management interventions. But I want to highlight that all of the people that we interviewed talked about the challenges related to the psychosocial impact of living with sickle cell disease and the stigma that goes with that. And I'm going to come back to the stigma at the end in terms of an intervention that we're trying to develop for young people. So in our lab, we do a lot of things, but I'm going to talk today about our online programs, our peer support program, and one of the apps that we have developed and tested in young people with sickle cell disease. So why peer mentorship? So the youth that we talked to talked about the fact that they really didn't know a lot of other people with sickle cell disease, even though they're in the clinic, and they may talk to a few other people while in clinic. And that the self-management tools are often clinician-led, tend to be impersonal, and the tools that were out there at the time really lack social connection. And so peer support is a way to provide emotional support, informational support, and appraisal support. And by delivering it virtually, you can really increase the access and flexibility. And more importantly, it's delivered by an adolescent or a young adult who gets it because they have the same condition. So I developed this program along with Dr. Sarah Ahola-Kahoyt, who was a health psychologist at the time. That she did a postdoc fellowship in my lab. And this is developed using an iterative process where we looked at what programs were available at the time in adults. We then did interviews with young people with various chronic conditions, so chronic pain, arthritis, sickle cell disease, to get input on this. We did a systematic review at the time to figure out what had been done, what worked best, what were the barriers. We consulted with professionals, individuals with lived experience. There was a conceptual framework by Cindy Lee Dennis that supports using peer support in adults that we modified, and then we developed the iPeer-to-Peer program. This was from the systematic review that we did, and at the time there were only 11 papers. Now there's a lot more papers in this area. But what the key findings said was that it's better to have someone that's slightly older, so training a young person that's moved on to adult care, having formal training in place, having frequent contacts, so at least once a week, and having live scheduled interactions tend to have better outcomes. So we developed this training program. It's a 2-day program, so we've now delivered this in person, hybrid, and virtual during the pandemic. It includes small group discussion, case activities, role playing, and this was our first group of mentors that we had. And you can see this is Keston, who is our a young adult with sickle cell disease who participated in this first program. We provide information on things like chronic pain, self-management, how to be a mentor, goal setting, decision support, problem solving, psychosocial issues, pain coping, resiliency. We talk about how to set boundaries, confidentiality, communication skills, and to date we've trained over 40 mentors across various different health conditions. And I'm just going to show you a little video of the program, so hopefully.
Hey there.
Hi.
I'm Liz.
And I'm Lindsay.
So were you a little nervous for this call?
Yeah, a little.
I'm super nervous, so I won't lie.
Okay.
So I don't know much about you, but I'll tell you a little about me. I'm not exactly sure the type of arthritis you have, but I'm assuming you do have arthritis, right?
Yeah.
Okay, so I have systemic juvenile.
Being a teenager can be stressful. You have a lot to think about, like school, friends, family, hobbies, and everything else. Now imagine being a teen with a chronic or long-term disease. You would also have to think about and manage medical appointments, medications, and therapies, and all when you're not feeling 100%. Learning to be independent and take care of yourself and your health can be complicated. Many young people who are living with a chronic disease have never met another teenager with the same condition. It is easy to feel like nobody around you gets it. So to help, a team of healthcare providers and researchers at the Hospital for Sick Children developed the iPeer-to-Peer program. iPeer-to-Peer uses online video calls to connect young people living with the same disease. Teens are connected with someone a little bit older who has gone through training to be a mentor. This is someone who gets it, someone who has been in the same situation and has learned how to cope.
My name is Shayla, and I live with chronic pain, and I am a mentee.
My name is Carly, and I'm a mentor.
My pain story started in 2010 when I was in a motor vehicle accident. So I have pain from my neck all the way down to my feet. I have nerve problems in my feet. It was really difficult for my friends to understand because obviously they're not going through what I've been going through.
One of the benefits of this program is that it was completely online. So there was no geographical limitation whatsoever. So if you were getting treatment at a hospital anywhere in Canada, or if you were living across the province, or even in different time zones, you could still connect with your mentee because it was all online.
I'd Skype her on my bed, like I'd be like this with my phone up here, like, hey, like, yeah, like I'm not feeling well. But with the Skyping it was really easy because it was like, I could still feel bad, but that would be the best time to talk to my mentor.
This is a program that I never had the opportunity to experience while I was a patient here at Sick Kids. I wish I had had the opportunity to meet a mentor, someone older who successfully was managing their pain and could learn strategies from them.
She offered me a way how to live with what I'm dealing with, because I know one of my biggest things was being able to accept it. And I ended up telling my mentor that, and she said that the only way for anybody else to understand what we're going through is in order for us to understand it ourselves. Yes, I've had bad days, and like, yes, I will have bad days and continue to have bad days, but what you do on the good days will overpower the bad days all the time.
This is such a promising program. I can reflect on even one of the mentees that I had that they mentioned that they are looking forward to actually being a mentor one day and hopefully having this experience available to them just because they enjoyed the conversation that we had and the relationship we built so much.
I'd love to be a mentor in the peer-to-peer program because I've seen how it's helped me. So I'd love to give back and like help someone else, like never give up, keep going. Remember where you started off, like it would be good to be able to get that motivation back going and being able to help someone else.
I actually don't have any other questions. No, it was really fun being your mentor.
It was really fun being your mentee.
So if you have any other questions or anything, you know where to find me. And good luck with everything.
So we did a pilot RCT in young people with sickle cell. This was after we had done pilots in arthritis, chronic pain, and inflammatory bowel disease, where we found that the program did actually improve coping and self-management skills as well as transition skills. So this was a pilot where we randomized kids to the program or to a waitlist control where they got the program after the 12-week period. We asked them to complete a series of 10 calls over a 12-week period, approximately one call a week or so. So we evaluated the feasibility and engagement. So adolescents did report that they found value in connecting with someone who understood their experience. But adherence to the actual protocol was really low in this population. And a lot of it was related to both the mentor and the mentee having to constantly reschedule their calls, which happened in other conditions as well, but not as much in this population. And only a third of the young people completed all of the calls. So most of the time they completed one call and then didn't continue on with the program. And so we weren't really powered, obviously this was a pilot trial to look at effectiveness, but given the low adherence and engagement, we didn't have any, obviously, impact on outcomes. We did do qualitative interviews with some of the young people that participated in the program. And a lot of them told us that they were interested in it. It's just that life got in the way is typically what they told us. And that so this really lacked the feasibility in this population. But these are some of the examples of, we analyzed all the calls that happened. So this was one mentor that said it was really important to help tell young people that you're not alone in the world, that we have experience that we can share. And one mentee said that this program was really fun, and we actually had a lot of similarities. And it was not so scary, but I think initially this young person said they were a little bit scared to start these calls, but once they got into them, they found that they really enjoyed it. I'm now going to move on to an app that we created called I Can Cope. So this is a digital smartphone app that we developed to empower young people to better manage their condition, to develop healthy coping strategies, and to receive social support through the app. The components of the app are a quick daily check-in. It takes less than 5 minutes. They can identify a body outline where they hurt and if that changes over time. But the most important aspects are goal setting. And then based on those goals, they're pushed feedback from a library of curated evidence-based strategies. And there's also a community function, which is kind of like a Reddit where we post things each week, like what's your favorite coping strategy, and then people can respond. So we've built this program over the last 10 years. We've developed it initially for arthritis and chronic pain. We have a post-operative app right now. We've done a study in young adults with neurofibromatosis. And then I'm going to report on the trial that we did funded by NIH. So importantly, this app was co-designed with young people with lived experience. So this is Jermaine and Gail. They were two patient partners that were actively involved in developing the content of the material. Again, it has the app features, but we also built a companion website, and I'll provide you with the QR code at the end, which is freely available now for parents. So we did this definitive trial to look at the feasibility and effectiveness of the program. And so we randomized kids to the I Can Cope app or to an app that just tracks symptoms. And we had them use it for a 12-week period, and then we followed them up 6 months after that. This is just the design, and the control group had an education website. These are just the outcomes that we track, so pain, number of days with pain, mood, activity limitations, coping, pain interference, and then engagement. We had an analytic platform on the back of the app. This is the consort diagram, and we randomized approximately just under 60 participants to each group. And you can see we had loss of follow-up in both groups, about the same, but outcome completion was actually quite high. So participants who were eligible for the study, the participation rate was 93%, which is actually really good compared to the last program that I talked to you about. And that post-treatment outcomes were completed by 92% of the participants, which again was really good. No differences between the groups in terms of sex, and then this trial did go on before COVID and after COVID, and we looked at some of the analysis related to that. But what we found is that there were significant improvements in the reduction of average daily pain at 6 months follow-up, and we almost had like a 1.3 reduction in pain on an NRS. More importantly, there were less days that these young people had pain in the app versus the control group, and there were also improvements in mood from baseline to 6 months. There was some movement in improvements in activity limitations, but it was not significantly significant, and also pain interference. But these are just some quotes from the young people. One person said, if I didn't have a good day, I would mark it down. It would encourage me to try harder, to have a positive energy. If I didn't have a good sleep the night before, I would be putting in a score of 2, which is very bad, and then I'd be encouraged to sleep earlier and to try to persevere for a better day. And overall, it just made me feel better. What we're doing now, because of the positive results from that trial, we were funded by CIHR to do what's called a Type 3 implementation effectiveness trial. And this is where we're working with sickle cell centers across Canada, where we're doing a preparation phase where we're actually interviewing the clinic staff to find out what's the best way to prescribe this to patients, what are going to be barriers that will get in the way of adopting this. Then we'll implement it, and then we'll synthesize the findings and develop kind of an implementation roadmap to be able to scale this up further to further sites. And I just want to obviously thank the sites that are collaborating on this and our patient partners. And then at the beginning, I talked about stigma, and I want to talk about it again here because it's really a social process that involves the perceived and enact labeling and stereotyping of people. And we know that young people with sickle cell disease feel very stigmatized because of their condition. It interferes with their health care. They're often labeled as drug seekers. And so it really creates barriers to optimal health care. This was a systematic review that was done a couple of years ago looking about stigma in sickle cell, and that it really elaborated that this is a health concern that we should all be trying to focus on, and that stigma can stem from things like institutions, healthcare providers, the public, family, and friends, and that stigma can have detrimental consequences, including negative social consequences, and ones that I'm interested in are impairing healthcare interactions. This is some work by a colleague that looks at stigma and its exposure during childhood and adolescence, which are particularly vulnerable periods of time. And because young people are still developing their coping skills, their self-efficacy, and their social power. And it's even more vulnerable as well when they transition into adult care. And then you can see the weathering of that as you get older in terms of the constant stress and wear and tear related to dealing with stigma on a daily basis. Anna Hood is a health psychologist from the University of Manchester, and she really focuses on racism exposure and trauma accumulation that can perpetuate pain inequalities. And she's created this model, and if you can see on the top, this is a biopsychosocial model of pain that we're pretty familiar with, right? In terms of some of the biological underpinnings of pain, the psychological and the social, and that people can be traumatized by having pain, but also racism can be traumatizing as well and still have those same biological, psychosocial factors that can lead to that. And what she's suggesting is that we should achieve chronic pain equity by improving training of healthcare providers, reducing some of the organizational barriers that young people face. And she does a lot of work with young people with sickle cell disease as well. This is Veena Mohabir. She's a PhD student in my lab, and what she's doing is she's developing a stigma reduction intervention that's going to be embedded within our I Can Cope app. So she's conducting right now a scoping review of methodologies to identify stigma interventions for young people with chronic illness. She's then going to be doing a co-design workshop with adolescents with sickle cell disease to try and design that intervention. She'll do a prototype and then do usability testing. So some key messages I want to leave you with are that it's really important to involve young people with lived experience when developing and evaluating interventions. And I'm not just talking about digital health interventions, any type of interventions. And that co-design methods are really valuable to ensure that the programs that we use try to promote self-management and are engaging. And that obviously just talked about the importance of addressing different types of stigma that can be experienced by this population as well as others. This is the resource that's freely available now for young people with sickle cell disease. You can scan it, the QR code. It's on About Kids Health website. We've partnered with them to develop this. And this education was developed by healthcare providers across Canada. I'll leave that up for 1 second. I'm happy to share the slides as well. This is the resource for parents that was co-designed with parents of young people with sickle cell disease, also available at About Kids Health. This is another portal that I want to tell you about. This portal was developed during the pandemic for young people with chronic pain, so it's not specific for sickle cell disease, but it's specific, more general for pain. It's freely available in English and French. It has you can see down here, there's like a tracker where they can track their symptoms over time. And similar to the I Can Cope app, it pushes them resources based on those check-ins that they do. And again, this is freely available. I'm just mentioning this because I think a lot of young people with sickle cell disease are reporting chronic pain now. And some of that pain may be neuropathic pain. And so this is a new tool that a postdoc, PhD student in my lab just created and validated. And so it's to identify neuropathic pain and then less common also pain problem, complex regional pain syndrome, and she just validated this in a cohort of 300 kids. And so this is also freely available. Just also want to mention just some free curriculum for people that this is targeting healthcare professionals related to pain, if you're interested. And then the last thing, in Canada, we have a new national standard for pediatric pain, and an adult standard is coming shortly. And so I just wanted to make people aware of this. The goal is to make pain better, make it understood, make it more visible. And these indicators will be part of accreditation moving forward. So you can download your copy there if you're interested, and then I'm happy to answer any questions you might have.
Really amazed by all the tools and everything that you've developed for the children. My question is about actually how did you manage to do all of that? And from what I understand, it started with research funding, but then there's the issue of sustainability over time, because there's all these great initiatives through researchers, but how do you make sure that they get really integrated into the health system and that they don't get lost when there are cuts and et cetera?
Yeah, that's a really good question. It's something I grapple with all the time. And the key is your partners. So for the web-based programs, I use About Kids Health, which is part of Sick Kids, and their whole goal is to create online education for patients and families. So once I got the grant, we developed with them, and that they've made the commitment to sustain them going to over time. So it's really key to determine that at the outset. And then for the apps that we developed with them with the Center for Digital Therapeutics, which is at UHN in Toronto. And again, they co-own them with me, and so they have a vested interest in maintaining them over time. And then there always is a life cycle, right? Technology changes so rapidly that things that were, in vogue 5 years ago or whatever aren't now. And then so you need to have a mechanism for also continually evaluating them and then remove them when they're no longer meeting that purpose.
Okay. I noticed that a lot of young people now are going on to like ChatGPT and AI and all this business. And there's like medical AI things, blah, blah, blah. Is the technology that you're developing, because this is where young people are at, and was wondering if you were implementing any kind of like app that links with some sort of, I know I'm a Luddite myself, so AI is beyond me, but that is where we're headed. And I know that kids will they're asking questions, they're using it as a therapist, they're using it as a doctor now. Is there any way that like say you have like an application that's attached to ChatGPT or something like that? Is that something that you guys are looking into the future for?
Yeah. So there's a bioethicist at Sick Kids, and she's been doing a lot of work interviewing young people about their perceptions of ChatGPT and AI and its role, specifically related to healthcare and the trustworthiness of it. And again, I think we need to educate young people about using those types of tools. We are trying to move into using some of them in the back end, because all of our apps are based on clinical algorithms of what we think should be recommended. But using all that data that you collect, you can actually use that to better tailor which advice to send to people based on the data that you're collecting. So we are moving in that way, but I think it's really our responsibility as well to educate young people about the pros and cons of using that, right? Especially for healthcare.
Yeah, absolutely.